We're talking this hour about the front page of the Daily Telegraph. NHS twice as reliant on foreign doctors. Britain has fallen behind other Western nations by failing to hire homegrown medics. Now, the paper has written up a study by the OECD, the Organisation for Economic Cooperation and Development, that found that in 2023, foreign-trained doctors made up 38 of the UK's medical workforce. That's compared with an average of 19%, just over that, across 28 developed and developing countries. There is more recent data from the General Medical Council, which regulates doctors in the UK, and found that the number has continued to rise, and now it looks like there are 42% of foreign-trained doctors working within the NHS. Now, if you contrast that with Germany, the figure is less than half of that, 15%. And in France, it stands even lower at 11%. Now, the influx of foreign doctors to Britain, which now tops 20,000 a year, coincides with UK medical graduates struggling to get training places. And, of course, this is one of the reasons why we saw recently junior doctors going out on strike, or resident doctors, as we should call them now. They were saying that part of the issue is that they train and they spend money on their exams and all of their training, and they don't actually have a job to go at the end of it. And that in some cases, the places are going to foreign medics, people who are not born in the UK, for the limited speciality training spots. And look, don't begrudge foreign doctors coming over to the UK. We absolutely need foreign doctors, but surely we can find a job for resident doctors as well who have been trained in the UK. The Conservative Shadow Health Secretary, Stuart Andrew, has said that the growing reliance on foreign-trained healthcare professionals is a wake-up call. As we bring in more doctors from abroad, UK-trained doctors are left fighting for fewer spots. To secure the future of our NHS, we must reform the system to not only recruit internationally, but also invest in and prioritise domestic talent. Do you see it as a wake-up call, the fact that we have so many foreign doctors in the NHS? If you do work in the health service, and if you are a foreign-born doctor, I'd very much like to hear from you about the situation as you see it. I mean, you are basically keeping the NHS up and running so that people can be seen, and your work is absolutely brilliant, and of course we value it. But what of the people training for medical places in the UK? Should there be a priority for them? Should we not make sure that people who have medical degrees and are clearly well trained and eminently capable of doing a job, such as a resident doctor or anything else within the health service, surely they can be put to better use than struggling to get a job? It seems like madness to me, but if you're closer to it than I, I'd very much like to hear from you. First, let's speak with Dr. John Puntis, who is co-chair of Keep Our NHS Public, the campaign, and a retired NHS paediatrician, and joins me on the line now. Dr. Puntis, thank you. How worried should we be that there is such a reliance on foreign doctors within our health service? Good morning.
Morning, Henry. Well, I don't think we should be that worried. I mean, as you already pointed out, the NHS is really extremely reliant on staff who've come from overseas, and the numbers may have increased somewhat. But, you know, even going back to early 1970s, when I started my training as a doctor, 1/3 of what were then called junior doctors were actually doctors from overseas. And currently, it's 1/4 of nursing staff who've been trained overseas. And actually, in social care, it's 1/5 of social care staff who come from overseas. So the NHS and social care services in the UK depend on migrant staff. And that's been the situation for a very long time.
But now we are in a situation, as you know, Dr. Puntis, where we have resident doctors who have trained and shelled out a lot of money for their exams, for instance, that now can't get jobs. I mean, if there are only a limited number of positions, then should they not get priority?
Well, I agree. That's quite an extraordinary situation that we're training doctors and they don't have jobs. But a lot of this, of course, has to do with workforce planning. And traditionally, the approach in this country has been quite conservative when planning numbers of staff needed, knowing that gaps could then be filled by staff from overseas. So we would need to have a really radical rethink about training and how many staff we want. And at the moment, it's estimated that across all staff, there's probably something like 100,000 vacancies. But actually, in the long-term plan for the NHS, the government is talking about there being a need for fewer staff in the NHS in 10 years' time, which
Really?
I find quite extraordinary. I mean, I think this is because of the hopes of AI, which is going to be the solution to everything. And also with the cash restrictions now being imposed much more stringently on trusts, many of them are looking at losing not just corporate staff or what people sometimes describe as backroom staff, but actually clinical staff, nurses and doctors. And some estimates have been that there may be as many as 150,000 job losses simply because pay is such a high proportion of NHS spending. And if you're forced to make cuts, that's the obvious place to make it. So this is all tied up with lack of long-term vision and lack of long-term workforce planning.
And I appreciate that, but why then is it 15% in Germany, 11% in France and 42% here in terms of foreign doctors?
That is a really good question. I'm not sure that the answer is necessarily clear. Certainly not many years ago, the proportion of doctors, not in Germany and France, but in other Anglophone countries, other English-speaking countries, was very similar to the proportion in the UK. But I think countries like Germany, I suspect that they have better workforce planning. Of course, they have a lot more doctors in relation to the population than we do in England. And I think they haven't relied on this model of bringing people in from abroad to make sure that the system continues to run. So we have this very long-term tradition of absolute dependency on people coming from overseas. And of course, that saves the UK a huge amount of money because we don't pay for the cost of their training.
Thank you for your time. Dr. John Puntis is co-chair of Keep Our NHS Public campaign and a retired NHS paediatrician.